Our guest today is the director of the Illinois Department of Health. He was appointed by Governor Pat Quinn just over a year and a half ago. Prior to his appointment, our guest today was the only official in New York State to simultaneously lead both the public health and mental health departments. He is a graduate of the University of California, Berkeley, where he also received a master's degree in public health. Our guest today lives in Chicago with his fabulous wife, Zuleika, and their 3 teenage daughters, Bailey, Layla, and Mesa. Ladies and gentlemen, Dr. LaMar Hasbrouck. Doctor.
Thank you, Jay. Good afternoon. So I'd like to thank Jay. I want to also thank the Board of Governors at the City Club for inviting me to speak today. I'd like to tell you that I am elated to have this opportunity to speak at such a historic venue and to take my place in a long line of people, personalities, and passionaries in sharing my work with this audience at the City Club here. I want to also thank again my wife and partner in service, Zuleika, who's here with me. Thank you. I also want to thank my teenage daughters. They're not here, they're at school, but again, Bailey, Mesa, and Layla. They're not here, but they inspire me daily. And I've realized as I've gotten up in years, older in years, that much of who I am as a man has been informed of who I am as a father. So I want to thank them and acknowledge them as well. And then lastly, I must confess that as a result of living in a household with a wife and 3 teenage daughters, there's little professional or personal drama that I'm ill-equipped to handle. So my attitude is bring it on. I want to recognize my team from DPH and ask them to stand up, please, briefly. Department of Public Health staff that might be here. Thank you all for your hard work. Leadership change. Thank you. Thank you for recognizing them. Leadership change can be very tense, and I appreciate your support. I want to acknowledge some special guests that have accepted my personal invitation to be here this afternoon. Most are sitting in the 2 tables over there in that area. They represent government officials, sister agencies, trusts, advocates, and academics. And I won't be able to name each of them by name, but I did want to recognize a few folks that I did personally invite and did make it out here. Senator Matty Hunter isn't here. Senator William Delgado, hopefully he'll make it here as well. John Moreau, thank you for coming. Representative LaShawn Ford, thank you. I want to recognize Michael Gelder. I'm not sure if he made it here. There's other members of the governor's team that I'd like to recognize who may be in attendance as well. About 2 years ago, as mentioned, I was the commissioner in upstate New York, and I responded to a national job posting for the director of the Illinois Department of Public Health. And just a few short months after that, Governor Pat Quinn offered me a position to serve in the great state of Illinois, and I haven't looked back since then. So I want to thank Governor Quinn, who is, as many of you know, is a true champion of public health, of health care reform, and he's led by example, and I want to greatly appreciate all that he has done in support of me. And lastly, I want to thank all of you for being here on this balmy afternoon. It does feel like family here, and so I want to thank you for being here. So I've entitled my presentation, Public Health for the Public Good. And I did so to highlight the many contributions made by public health to the greater society. And it might surprise you to know that in 1900, you could expect to live to the ripe old age of about 48 or 49 years. And since then, it might also surprise you that we have expanded our lifespan by about 30 years. And while advances in medical care, such as acute care or management of diseases, are credited with 5 of those years of the 30 years of expanded life, 25 years of this gain is attributable to advances in public health. And that might surprise you as well. So we're talking about longevity, and when we talk about the 25 years of the 30 years of expanded life, 10 of the public health achievements, or 10 great public health achievements, are most often highlighted for this contribution to lifespan. Those include safer and healthier foods, healthier mothers and babies, vaccinations, motor vehicle safety, controls of infectious diseases, fluoridation of water, workplace safety, decline in heart disease and deaths from strokes, family planning, and tobacco control. So all these are significant public health contributions to the public good, yet if you ask the average person what is public health, they wouldn't know. Or they might reply that it's health care for low-income families. One of the oldest state agencies, the Department of Public Health, was created in 1877 to regulate medical practitioners and to promote sanitation. And since then, we've grown from a staff of 3 and a 2-year budget of $5,000 to an agency with an annual budget of more than $500 million, headquarters both here in Chicago and in Springfield, 7 regional offices, 3 state laboratories, and 1,100 employees. And despite our relative anonymity, if you've eaten at a restaurant, required hospitalization or nursing home care, vacationed at a campground or swam in a public pool, drank a glass of milk, got married or divorced, had a baby, the Illinois Department of Public Health has touched your life in some important way. Ensuring the quality of our food, setting the standards for hospital and nursing home, checking the safety of recreational areas, overseeing the inspection of milk-producing farms and processing plants, maintaining the state's vital records and screening more than 170 newborns for 40 metabolic and genetic diseases every year. Those are just a few of the things that we do. In fact, our nearly 200 programs, everything from the Illinois Poison Center to the Tobacco Quit Line, touches virtually every age, aspect, and cycle of life in the state. And with the assistance of the local public health agencies, we are the core of Illinois public health system, a system that forms a frontline defense against disease through prevention measures, credible information to enhance health decisions, and partnerships with organizations to promote good health. Notwithstanding this worthy and what I would argue is an audacious mission, lean fiscal times have forced us, like every other organization, to examine smarter, more efficient ways to meet the mark. So during the past year, we've engaged in a process of self-study to answer this fundamental question. How do we maximize our effectiveness, influence, and value to improve the health outcomes for Illinoisans? And we answered this by addressing these 5 areas that you see: growing partnerships, improving the quality and packaging of our data to better inform policies, programs, and priorities, closing racial, ethnic, and regional health gaps through targeted outreach and approaches, improving regulatory compliance, and communicating to the public what we do in a clear and consistent way. We've linked these 5 priorities to the State Health Improvement Plan and to a renewed commitment to continuous quality improvement and customer service so that we can be of greatest good to the public. This blueprint for service, some of them are at our tables here. They're called the Illinois Department of Public Health 5-Year Strategy. It was just released last month, and it sets the standard for our accountability to residents here in Illinois. It's available on our website, and I encourage all those who are interested to take a look. So the next achievement of public health, yet to be realized, that I want to discuss today is a public health problem that impacts us all. It's a problem that kills more young people than cancer, heart disease, stroke, diabetes, birth defects, influenza, and pneumonia combined. It accounts for nearly 1,000 deaths every 3 years, and it is the second leading cause of death for people aged 15 to 24. And among 10 to 24-year-olds, it is the leading cause of death for African Americans. The public health problem that I'm referring to is homicide and violence in general. And we know that homicide and violence in general is a persistent societal problem. We also know that this problem is concentrated in Chicago and Cook County and surrounding collar counties, as shown here, where every red dot represents a homicide. And as you get to the northeast portion of the map, those red dots would come off the page or the screen about this high as they're stacked on one another, representing the bodies that have been lost over the 3-year period. And while homicide disproportionately impacts Cook County, accounting for 80% of young victims in this age group, as you can see on the map, the problem is widespan and spans the entire length of our state. But why is violence a public health issue? Well, let me offer 2 compelling reasons. Number 1, because of its burden to the health of the public. And not just in terms of death, but also measured in terms of injury, disability, disfigurement, and despair. The psychological burden for children exposed to violence, and in terms of the anguish for parents and family survivors, and ultimately as measured by the ripple effects that can destabilize entire communities. And it's important to understand that homicide is just the tip of the iceberg, because it's estimated that for every 1 homicide, there are hundreds of non-fatal violent injuries, as represented here. Not to mention the countless acts of violence that go unreported or that don't come into the doors of the medical complex. The second reason I would argue that violence is a public health problem is because violence is preventable and not inevitable. And therefore, violence is amendable to the public health approach. And the public health approach is the same principles that have led to decrease in motor vehicle crashes and improvements over the last 10 or 20 years in infant mortality. And it's an approach that can reduce the number of injuries and deaths caused by violence. And the steps include defining the problem, that is the scope, some of which the information I just shared with you, the trends over time. The next step includes things like identifying potential causes by collecting and analyzing potential risk factors and protective factors, including some mentioned here, antisocial parents, poverty, substance abuse, which are known to be risk factors, and protective factors such as commitment to school. It also includes then developing and testing strategies based on what we learn about risk and protective factors, abandoning those that don't work and that can actually be harmful, and then taking those that actually work and sharing those proven programs and strategies with communities at risk. So it is no simple solution in terms of making the case for prevention, but it's important to understand that we do have some tools at hand. Violence results from a complex interplay between family and personal, sometimes community and environmental factors, and tackling the problem of violence can be difficult, but there are several reasons that we can make the case for prevention. Number 1, there is 30+ years of science supporting the public health approach, and this is an approach that expands beyond the criminal justice rehabilitative model alone. In addition, there are models and promising practices that have been shown to work, and there's also those that have been shown to be not only harmful, but ineffective as well. In addition, there are multiple ongoing efforts here in Chicago and across the state, some led by the Department of Public Health, such as the Violent Death Reporting System, some in Chicago, such as Get In Chicago, a new $5 million investment, and we have Tony here representing that program. There's state grants from the Criminal Justice Information Authority and grassroots advocacy efforts and more. But also there are untapped assets out there that we've yet to realize the promise of. Faith-based organizations, community-based organizations, eager to do their part, but who lack the resources and actually in order to do so. And then most importantly, there is sustained and unwavering commitment from our governor, Governor Pat Quinn, other elected officials that are here today, and other leaders to address the problem using comprehensive approaches, understanding that no one solution to this problem exists, which includes putting prevention to work. So I want to share with you one of the latest efforts in terms of the state's movement to address this problem of youth violence, and it is the Violence Prevention Task Force. We've just begun our work. It is a 6-member task force. It was established by statute, House Bill 2879, sponsored by Representative LaShawn Ford and Senator Mattie Hunter. It was signed into law by Governor Pat Quinn, who then appointed me to be the chair of this task force. And it is designed to have active participation by both the Latino Family Commission and the African American Family Commission representatives who are here today. And our mission is not going to be to solve the problems. Obviously, no one ever can do that. But our mission is really going to be to connect the dots to better align and coordinate existing programs, to enhance funding opportunities, and most importantly, to transport those proven strategies to communities at most risk. So I'm very excited about what this work can mean for Chicago, what this work can mean for the state of Illinois, and I'm grateful to the governor for tapping me to lead this effort, not only because of the potential lives that we can save, but also because it will allow me a chance to bring both my personal and my professional experiences to bear on this public health priority. And as you may know, I'm a transplant here into the state of Illinois, and you don't know much about my story, but I can tell you an opportunity like this will allow me to marry experiences that I've had that have shaped really over the years my perspective on this problem. Things like growing up fatherless on G Street, a typical inner city neighborhood with typical inner city problems and witnessing violence firsthand. Things like driving on a desolate Los Angeles interstate in 1992 during curfew of the martial law imposed after the Rodney King verdict. And remember feeling so uneasy about a city about to explode. My work organizing nonviolent student demonstrations and healthy ways to vent the hurt and ways to begin the healing in the wake of these riots, and the years spent in medical training at a place in South Central Los Angeles called the Martin Luther King LA County Hospital, a place referred to as Killer King because of the volume of gunshot wounds treated in the trauma centers there. And then I reflect on the years of work at the Centers for Disease Control, researching violent prevention strategies and co-authoring the first Surgeon General's report on youth violence prevention and building those partnerships along the way. So these experiences in the context of a 20-plus year career as a public health practitioner have come together in wonderfully unpredictable ways to lead me to this place and this opportunity right here. And you know, they say that sometimes you don't pick the job picks you. Well, I certainly feel that I am in my blessed place in this endeavor and in this job in general. And as a result, I have every reason to be hopeful. And while even the proposition of preventing or significantly reducing violence seems overwhelming, and it certainly does to me at times, I'm convinced that we have the knowledge base and the tools to make it happen. And what's more is there are grandmothers willing to line safe passageways from home to school, with every expectation that their child will make it to school and make it home again. There's teachers and there's counselors that show up every day determined to teach in less than optimal conditions, and there's fathers and there's stepdads and there's other men willing and able to stand in the gap for young people and lead by example. There are concerned public officials, there's philanthropic organizations, there's you, there's me, there's everyday people who care. So I would say to you that we have more than a chance. I would submit to you that we have a destiny. And I challenge each of you to find your place on the front lines. And as for Department of Public Health, well, transforming health of the public one community at a time That's what we do. You can say it's a part of our agency's DNA. And if I have my way, the next great achievement in public health will be reducing violence for the public good. Thank you.
Good job, man. See if you have any questions. Jack, anyone with questions, raise your hand. Write them out clearly. Go ahead, Jack. Go get them. Tweet. City Club moves them. You got to write it out. No texting, no tweeting. That's why John Tolba left the city. We forced him out. Okay. Veronica Cunningham. Very nice handwriting. Printing. Safer Foundation. Kind of a long question there for you, LaMar. Now that, you better take your glasses back. Now that Governor Quinn has signed an executive order to ban the box. You know what that is, right? What is ban the box? Am I reading that right? Keep reading. Remove the question. Have you been convicted of a crime from state job applications? Oh, ban the box. Okay, okay. What is your position on hiring persons with criminal records to fill appropriate vacancies in healthcare? Nothing wrong starting off with an easy one.
So I don't need my glasses, I guess. So, you know, I've come to learn that there are communities at risk for violence and communities with concentrated area violence for a number of reasons. And one of those reasons is that there are deficits in those communities. And if we can understand what those important deficits are, joblessness, fatherlessness, other deficits, poor education, if we can find out what those deficits are and replace and fill those deficits, we can actually begin to buffer some of our communities from the ills of violence. So when you're talking about criminal involved or justice involved individuals in the prospect of employment, my position is that if you take a person, a man, for instance, out of his household, and you put him in jail for whatever reason, and that person serves his time, but comes back to the community, but yet is unemployable, cannot have a job, then you have a deficit that remains that is very significant and that is going to put that family and that community in harm's way. A long way to say that I believe that justice-involved individuals who have done their time, who have paid their debt to society, who are employable, should be employed, because we have to apply every single, address every single deficit.
Okay. Tom Irving, member of the City Club. Where are you, Tom?
Tony.
Tony. Forget Tom. Tony, where are you, Tony?
And that's Michael Gelder next.
Pardon?
That's Michael Gelder next.
Oh, all right. Well, it's a hot table then. What do you consider the key or formula for success? Who are the necessary stakeholders?
Well, I think that the necessary stakeholders, for one, are in this room today. You know, I think that we all have a part to play. I think that we all have a position on the front line. And I think that the more that we can galvanize the efforts, interests, and passions of folks who have some aspect to this, to solving this problem, I think the better off we will be. Obviously, it may take some money, but obviously, I think more importantly, it takes community cohesiveness. I think it takes commitment, and I think it takes working together to promote and disseminate those things that we actually know work. Trying children as adults, for instance, don't work, it's harmful. Scared Straight, for instance, doesn't work, it's harmful. The DARE program doesn't work. So we need to propagate those things that we know scientifically result in improvements and disseminate those out to those communities most at risk. And I think we all have a moral responsibility to get involved.
Got two more. One from State Representative Duncan, fighting representative from the West Side. In stopping the violence, what would you like to see the General Assembly accomplish this session? You can stop right there, but we'll go on. In legislating or funding?
Well, you know, I think we have a start. You know, we've been inventorying a lot of the efforts across the state, and one of the things the task force is going to be doing is learning up on all of the programs and things that are going on across the state and trying to connect the dots so that we can align our efforts better. I'm convinced that we have the tools. I'm convinced that we have an inventory of practices and strategies that actually work. What we may need is some resources, some money to actually begin to, after we hotspot these communities, which we know very well, to actually begin to design comprehensive programs that target these communities and do some type of readiness assessment for communities to make sure that they have the will, the infrastructure, the community support to actually implement some of these avenues. So we have some good starts across the state. We're going to need some money. We're going to need a little bit of time to get ourselves organized.
Final question from the Honorable Donovan Pepper. Now with Walgreens, if you want a complete list of all the jobs he's had, 10 cents in coin, Merkle Press, no problem. I've known him for a long time. Here we go, from Donovan. Since this is National Immunization Week, we all knew that, can you describe the importance of getting immunizations for adults and children? Each 25 words or less.
All right. Well, you know, I may have a couple talking points on this subject, given what we do. But basically, there's two things to do to protect yourself from the flu this season and every season. Every year, flu comes right on time, and every year not hundreds, but thousands of folks die as a result of the flu. Getting a flu shot is the most important way to prevent from getting flu, but also we recommend a number of hygiene things around covering your cough, washing your hands, and staying home if you're sick. So there's a number of things that we can do to keep ourselves well regarding the flu.
How about a round of applause for our speaker? Good job.